So shave versus discoid versus segmental bowel resection. When endometriosis involves the bowel, the rectum, the sigmoid, different parts of the bowel, there are different techniques that we use to deal with that. And it's probably helpful to explain what those mean. Shaving is when the disease is sitting on top of the bowel but has not gone deep into the muscle of the bowel. And that's where we can take it off the surface of the bowel. We call that a shave of rectovaginal endometriosis. Then we have a segmental bowel resection with which is the other extreme. That usually is done when endometriosis has gone into the bowel and it's larger than around 2, 3, 4 centimeters. It very much depends on the circumstances. When we do a segmental bowel resection, we always have the colorectal surgeons there, and what we do is we cut below and above the abnormality, and then we join the two ends of the bowel together. That's called a segmental bowel resection, sometimes called an anterior resection. That is usually used for the more severe types of endometriosis that have invaded into the muscle of the bowel beyond the shaving or the discoid. What's the discoid excision? Discoid excision is basically cutting away the abnormal area and then repairing the defect, but it is a full thickness removal of usually the front wall of the rectum or the sigmoid, usually the rectum. More recently, we can do the discoid resection using a stapler. So if you hear transanal stapler discoid resection, that's what it means. It means that we insert a stapler, which basically is a device that puts metal staples as opposed to us suturing, because it's better quality closure, and then we feed the disease into that device and it does the rest of the job for us. It cuts away the tissue and closes on both sides. That is a transanal discoid excision of endometriosis.